Now, hundreds of thousands of women in England are to be offered a drug which could substantially reduce their risk of developing breast cancer.
Seems to be a really important health story, this, doesn't it?
Absolutely.
Trials have shown that anastrozole, it's a hormone therapy used to treat the disease, can also prevent cases. The charity Breast Cancer Now has described it as a major step forward.
We're joined now by GP Dr Helen Wall. Morning, Helen.
Hi, good morning.
This is news that's just coming through to us today. How important is this development?
It's hugely important because we know that there's a breast cancer diagnosis in the UK every 10 minutes. That's one person every 10 minutes gets breast cancer, and you know that's massive. And there's about 300,000 women who are high risk for breast cancer who will be eligible for this drug after the menopause. And in fact, I'm one of those high risk women. So it's a hugely close to my heart story this morning coming out.
And Helen, I remember you telling us once before that your mum died of breast cancer. Is that right? So that's what puts you into this category.
Yeah, so my mum died of breast cancer about 17 years ago now, just before I became a doctor. And she'd struggled and suffered with breast cancer for a long time before that. And, that the thought that she could have had something that would have prevented that is huge. But yes, I'm one of the high-risk women because not just my mum, but other family members. I think it's important to say that, there'll be lots of people watching this who have a mum or a grandma or an auntie who've had breast cancer. They may not be eligible to be high risk. You have to go through the genetic screening service and they will look at the whole family history. And I had several relatives who'd had breast or ovarian cancer going back through my mum's line, and that's what put me at high risk, and therefore I have a mammogram every year. But yeah, it won't be every woman who's got a mum or relative who will be eligible.
And Helen, do we know how this drug works, how it helps?
It's suitable for estrogen-dependent cancer. So we use it for women who've had an estrogen-dependent, hormone-dependent rather, breast cancer, and it works by reducing the estrogen. So this is where it becomes a little bit of a downside, because whilst it's brilliant that it could reduce breast cancers by half in those women who are high risk, what the concern for me is, it does have side effects because it reduces estrogen. So we do a lot, don't we, about putting women's estrogen back in terms of menopausal symptoms. What this does is will reduce the amount of estrogen. So it does inflict possibly some side effects such as hot flushes and weakness and bone tenderness. So it will have side effects to it, unfortunately. But obviously the benefits could be huge, which is brilliant.
And I guess another advantage for the NHS is that it's relatively cheap.
Yeah, I mean, it's what we call off patent. So when a drug's off patent, it means that many drug companies can make it, not just the drug company that introduced it. So that means it becomes much more cheaper because market forces intervene and it becomes a relatively cheap drug to get. So yeah, it's not, in the grand scheme of how much breast cancer and the treatments for it cost the NHS, it could be a huge, cost saving at this to give women this drug.
Helen, we know in situations like this, when we talk about a drug or a change of use for a drug, it doesn't always happen straight away. How long might it take until women are able to start taking this as a preventative measure?
Well, I don't think that's very clear at the minute, and I know there'll be lots of GPs this morning waking up to this news expecting to see lots of women coming through the door, ringing, wanting to know if they are eligible for this drug. And what I would say to people is, please just hold off for now, because we don't have any information. This has broke this morning to me as a GP, as it has to everybody else in the country. So, we don't have that information at our fingertips yet. We're hopeful that this will be it will be quick because it has been going through the pipeline for a long time now. This drug was approved as a preventative drug as well as a treatment drug in 2017. So it's taken that long to get to this point where the Medicines Regulation Authority have agreed that it can be used for this indication, but we just don't know how quickly we'll be able to actually prescribe it or what the what the eligibility for that will be. So we'll have to await that information.
Dr Helen Wall, thank you so much for talking to us this morning. Thanks, Helen.
Thank you.
It's 21 minutes past 7. We've been talking about the fact that it's the state opening of Parliament today. The King will deliver his speech, but at the same time, a green carpet will be rolled out with royal flourish on the other side of the world, in Singapore, for a star-studded Earthshot Prize ceremony.
Prince William founded the awards in 2020 to honour people for their contributions to environmentalism. Well, our royal correspondent Daniela Ralph is there for us this morning. Hi, Daniela. What can we expect to see today?